What if your body was sending you warning signs, but you didn't recognize them? It's a condition impacting thousands of mothers, often silent, but potentially deadly. Today, we uncover the truth about pre-eclampsia. Plus, lupus, a disease that can hide in plain sight. What is it? How does it impact your body? You'll hear from someone living with lupus, share the reality behind the diagnosis, the challenge, and the strength it takes every single day. Answers, insight, and the information you need to take control of your health starts right now on Second Opinion. First up, a condition that I am very familiar with as a new mom, pre-eclampsia. It is a leading cause of maternal and infant illness and death, contributing up to 15% of maternal deaths globally. This potentially fatal complication of pregnancy involves extreme levels of high blood pressure, causing damage to the blood vessels and overall inflammation. It can lead to multiple organs failing, including kidney failure, strokes, heart failure, and yes, unfortunately, death. Early recognition is key. So joining me now to teach us about this challenging condition is Dr. Jenelle Robinson, an OB-GYN. Welcome, Dr. Robinson.
Oh, thank you so much for having me. How are you doing today, Dr. Hilton?
I am doing well. You know, and this condition, pre-eclampsia, it hits home for me because I actually developed pre-eclampsia after my baby. So can you talk to us? Everyone has heard of someone who had pre-eclampsia, right? But what exactly is it?
Sure. Thank you for having me, and thank you for asking such an important question. So maternal health in the United States, I'll first just start out by saying it is at a critical point right now. One of the leading causes of maternal death and increased maternal morbidity in the United States is going to be contributed to certain diseases. And one of those in pregnancy is called pre-eclampsia. Now, pre-eclampsia is marked by having severely elevated blood pressures after 20 weeks of gestation. So those blood pressures can be greater than 140/90, in addition to having some severe features. Some of these severe features can be headache, it can be severe headache, it could be also visual changes, blurred vision, it could be liver changes, organ dysfunction. So there's elevation in your liver enzymes. There could also be elevations in your kidney function. In addition to that, there can also be, features that can affect the baby. It can cause the placenta to separate from the fetus and can ultimately, unfortunately, lead to fetal death as well as maternal death.
You know, that sounds extremely scary. How common is this condition? Like, am I just a random person out of the blue, or are we seeing this more and more?
Sure. So this condition, it actually affects anywhere between 6 to 8% of pregnancies. So it is rather common. One of the things that we do see is that it's definitely more common in Black patients. The reasons for that disparity, it stems from there being a potential genetic component. There also is a component of biases that exist in healthcare. There's something called weathering that we find in that just mothers that deal with chronic stress in their lifetimes, they're more predisposed to developing preeclampsia. Having a history of obesity, carrying multifetal pregnancies such as twins and triplets, IVF pregnancies, having an underlying condition such as chronic hypertension or diabetes, having some of these risk factors does predispose patients for preeclampsia. So it is common, and we're seeing it more and more just because of all the various factors that I mentioned.
You know, as you're reading out those risk factors, I'm like age, race, multiples, like check, right? So I knew going into the pregnancy that this was going to be a huge risk. Are there things that we can do? If you're a woman that's listening right now, you're like, wait, she's listing off my life. Is there anything we can do to help mitigate or to prevent preeclampsia?
Sure, absolutely. So there is no way to 100% prevent preeclampsia, okay? But what we can do is lower the risk in developing preeclampsia. Some of those things are, number one, seeking early prenatal care. And number two, making sure that, that you have access to high-risk doctors, such as maternal fetal medicine physicians. Also, making sure that when you go to visit your doctors, you are coming in with support persons, such as a spouse or a family member, that can encourage certain things. One of the things we like to initiate is to start on a low dose aspirin, otherwise known as baby aspirin, 81 milligrams. And we generally like to start that anywhere between 16 to 28 weeks of pregnancy. This does help to prevent preeclampsia. We also will identify those high-risk patients early on and also try to initiate monitoring their blood pressures at home. So this is a key way that we can catch preeclampsia early in the stage of pregnancies, and this way we can intervene earlier. So getting early prenatal care, initiating baby aspirin, given the history, remote patient monitoring of the blood pressure are things that we can do to help lower the risk.
And what blood pressure, if someone says, okay, I have my blood pressure monitor at home, what pressure should trigger them to say, I need to be seen immediately?
Sure. Good question. So any blood pressure that is 160 over 110 is an absolute, I need to be seen right away. Okay. However, blood pressures that are 140 over 90 are considered to be, extra monitoring is considered to be advised for those patients. So if we identify patients during their routine prenatal visits and they are having blood pressures that are greater than 140 over 90, at least 4 hours apart, these patients are put in remote patient monitoring programs where they will check their blood pressures once in the morning, once in the evening, to make sure that we don't miss a very elevated blood pressure. So if patients are seeing a physician that doesn't have this type of program set up, the way it is set up in my office in the Kaiser Health System, then we would advise definitely purchase a at-home blood pressure cuff, take your blood pressure in the morning as well as in the evening, and just remember these parameters. If that blood pressure goes higher than 160 over 110, either or, definitely let us know. And less than that, 140 over 90, we pretty much want to make sure that we monitor that effectively.
Mm-hmm. And will they always be tied to symptoms? For instance, if you're checking your blood pressure and it's 160 over 100, but you're not having any symptoms at all, is that a fair pass to say, well, I don't necessarily need to call my doctor?
No. So definitely, there are, your average patient will have symptoms with a blood pressure that is that elevated. Okay. Whether it's a headache, it may not be at that time, but they may give a history that says, oh, you know what? I had a headache yesterday or had it 3 days ago. So a lot of times there would be some signaling that your body may give you, such as headaches, such as visual changes. Sometimes they can also come in the form of edema, where the lower extremities can be really swollen. Sometimes there can also be abdominal pain. There's also the symptom of, something that's not too descriptive, but they may just say, I just don't feel right. But to answer the question in all, whether or not you have symptoms and you have an elevated blood pressure, that warrants further investigation. Because oftentimes, some patients may present with the blood pressures first and they develop symptoms later.
Yeah. Just for the viewers, my blood pressure was 200 over 110 and I had zero symptoms. It is the scariest thing because Lord knows I was heading towards a stroke or heart attack or death.
Wow.
No symptoms whatsoever. And, and questions for you, for women who are like me, who undergo and pregnancy and we have preeclampsia, what does that mean for our chronic illness afterwards, right? Is there any propensity for us having cardiovascular disease or any other types of conditions based on the fact that we had preeclampsia?
Absolutely. So patients that have a history of preeclampsia, they are at a higher predisposition for developing hypertensive disorders even after the pregnancies. So it brings up a good point in that, the postpartum period, generally stops it at 6 weeks. But we oftentimes will encourage patients, make sure that you're checking your blood pressures with your primary care provider. We make sure that they are being seen routinely because the development of chronic hypertension is very high in patients who have had preeclampsia in the pregnancy. The risk for future pregnancies in developing preeclampsia also increases as well.
Mm-hmm. And that's why those will be my first and my last pregnancy. Now, here's a question for you. You know, some women may say, well, throughout my pregnancy, my blood pressures have been fantastic. I just delivered my baby. I should be in the clear from preeclampsia. Is that always true?
No, it is not true. So preeclampsia can actually develop during pregnancy, primarily after 20 weeks. It can develop during labor, okay, which is very common as well. And preeclampsia can also develop after pregnancy. And so the threshold, you know, we try to monitor patients all throughout. If you feel like something is wrong, if you develop any symptoms well after having the baby, you know, you are still at risk, especially in those first 6 weeks after delivery. And matter of fact, you know, we do find a correlation with pregnancy-related deaths and morbidity and mortality even up to a year after a patient has delivered. So while we say 6 weeks, you know, you really, really want to monitor yourself the whole 12 months after delivery.
Yeah. You know, for the viewers, not to make it about me, but my blood pressure didn't go that high until 3 days after my babies were born.
Yes.
3 days. And it was one of those things where, you know, you may brush it off of, oh, I'm just tired, or I've been up with the twins trying to feed everyone. And it could be your body's warning sign. So,
correct.
Question for you. If it's a mother right now who's pregnant and or has already delivered her baby, is there something she should be asking her doctors in the prenatal visits and the postnatal visits to say, hey, should I be checked for preeclampsia? Is there anything that should trigger her to think that way?
Okay, good question. So generally speaking, when moms come in for their pregnancy appointments, you know, we as the providers, we will do thorough screening. So we will, you know, identify those patients that are considered to be high risk. So patients that are high risk, again, are patients that are the age of 35 or older, if they're carrying a multifetal pregnancy, if they have IVF, if they are obese, meaning they have a BMI that's greater than 30, if they have pre-existing conditions such as diabetes or hypertension, if there's a family history of preeclampsia, you know, if there's lupus, if there's some sort of antiphospholipid syndrome, these are patients that we are going to identify as being high risk. So those patients, we're going to do labs really early on. And those patients, we also may get them enrolled in a blood pressure monitoring program pretty early on, whether or not they exhibit symptoms just based upon their history. But at the least, these are patients that we would initiate starting baby aspirin. So as a new mom that's trying to stay ahead of it and making sure that they don't develop this, I would make sure that, number one, they get early access to prenatal care. They go to their visits and they're really upfront with their physicians in terms of their family history and their personal histories. And together with the doctor or their clinician, you know, we would identify them as being moderate risk, high risk, or low risk patients for preeclampsia. The key is prevention. So the key is if they feel any type of way, feels like something is just not right, you know, you just listen to your body. And one of the things on the provider side, you know, is for us as providers and clinicians is to listen to our patients. You know, if a patient says, I have a headache, I've been having a headache for the past 3 days, you know, something feels off, you know, I'm having some blurry vision, some spots and floaters. These are patients that we want to take an extra look at to identify and make sure that they're not developing preeclampsia. So it is a collaborative effort between the patient as well as the provider to make sure that we identify these patients.
Well, Dr. Robinson, thank you for reminding us that recognizing preeclampsia early can literally mean the difference between life and loss. So yes. Thank you. And I'm certain that you are helping to save a life.
Yes, thank you so much. I'm happy to be here. Have a great day.
Still to come, living with lupus is a disease that impacts the lives of nearly 2 million Americans, and 90% of them, well, they're women. We explain why. Stay with us.
I'm Brittany Noble, Midwest-born, HBCU educated with experience in newsrooms across the country. Well, I've teamed up with Roland Martin to bring to you The Breakdown. This isn't just news. It's our stories, our voice, our community. Join me for The Breakdown, Monday through Friday at midday, only on the Black Star Network.
A decade of love, joy, and power. Black Voters Matter is 10 years old, and we are just getting started. This is love with a purpose. This is Black joy in motion. This is unstoppable power. Across campuses, neighborhoods, and back roads. Let's go! We show up, not just to vote, but to be seen, to be heard, to belong. We ride together, we organize together. We remind each other that our voices matter, because they always have. Black Voters Matter is about more than ballots. It's about housing and healthcare, clean water and living wages, education, reproductive freedom, and dignity. It's about turning pain into action, turning belief into movement, turning community into power. We don't wait to be invited. We bring the energy. We bring the love. We bring the people. Because when Black communities come together, we don't just survive, we thrive. This is how change happens. This is how history moves. We organize, we build, we win.
An estimated 1.5 million Americans are living with a form of lupus, according to the Lupus Foundation of America, and the majority are women. Joining me now is Dr. Ashira D. She is the Assistant Professor of Medicine and Co-Director of the Lupus Center, Division of Rheumatology at the University of Maryland School of Medicine. She is also an active member of the National Medical Association. So welcome, Dr. Blazer.
Thank you so much. Thank you for having me.
Yeah. So tell the people, what exactly is lupus?
Yes. So lupus is an autoimmune condition, right? So we all have an immune system. It's supposed to protect us against viruses and bacteria, but sometimes our immune system can become confused and start to be active against our own healthy tissues. So there are a number of different kinds of autoimmune conditions, but lupus is one that can really affect the whole body, right? So the white blood cells are the cells of the immune system. I tell my patients anywhere that the blood can go, lupus can go. So some people may have joint problems or arthritis. Some people may have rashes. Most people will have fatigue, some hair loss, and some people can even have internal organ involvement like kidney disease or heart or lung disease.
And when you say they can have heart and lung disease, how exactly does it show up? You know, we think about lupus and sometimes we think about the rash that's on the face, right? So is it just a scarring of the organs or do they no longer work?
Yes. So that's a great question. So with lupus, you get inflammation, right? So you have activity of your immune system that can affect multiple organ systems. So in the heart or lungs, you may get inflammation of the lining of the heart or the lining of the lungs. And that can heal with a scar, actually. So we think about active lupus, meaning that the immune system is particularly active at a moment. But then we think about how over time, each of those moments of activity can heal with scar. And that scarring is what can cause a lot of disability and shortened lifespan in lupus patients. We call that organ damage.
And what are some of the common triggers that causes lupus to flare, right? There's some people that you hear that have a controlled lupus, and you look at them and they're actively, living life. And there are other people who have lupus flares, like my cousin, who unfortunately passed away when she was 23.
I'm so sorry.
What's the difference in those two?
Yeah. So essentially, as you said, lupus is a problem that you'll have periods of time where it's very active and periods of time where it sort of comes back inactive and it sort of ebbs and flows like that, right? So there are many common triggers of lupus flares. Many of my patients will say, if I get particularly stressed out, I will have a flare of my lupus. So that's a very common one. Also infections. If you get a cold or a flu, the immune system becomes active to fight the infection. But then if you have lupus, that activity can spill over and lead to a flare. Sun exposure. This is one thing that we really need to think about as people of color, because often we think that we don't need sun protection, right? We already have sun protection, but it's actually true, especially if you have lupus, that you need to protect your skin from the sun, because that sun exposure can trigger a flare. So these are the most common, but patients may find that different things may trigger their flares, and each patient can be a little different.
Lupus is also often called the great imitator, right? Yes. Why is it so often and so commonly misdiagnosed, and how can patients advocate for the right diagnosis?
Yes. So that is a very complex question, right? Because first thing you have to think about is who's affected by lupus, right? So 9 out of 10 people living with lupus is a woman, right? Mm-hmm. 40% of lupus patients are African-American and 70% of them are women of color, right? So when we think about these groups, these are groups that are often not heard in the healthcare system. And then on top of that, lupus, so, the way we diagnose lupus is we have blood tests that are supportive, most commonly the ANA, though not everyone with a positive ANA has lupus, but we've got the blood tests, and then we have symptoms. And you have to have at least 4 symptoms of lupus in conjunction with the blood test to get a diagnosis. There are 11 different symptoms that can be criteria for lupus. So if you think about that, there are 333 different ways to have lupus, right? So this is something that has a highly variable presentation. I always say lupus patients are like snowflakes, like no two are alike. And so you have to have a doctor who has a high index of suspicion, who is looking for all of these symptoms that could be lupus, and who listens and hears what you have to say and puts it all together and legitimizes your experience. And that can be hard to come by, especially for the populations who are most affected.
Right. And it's one of those things is you as a patient may need to know your body and be able to advocate for it more than even some of the providers, right? So the question is, you mentioned some symptoms. I think you said 11. Can you give us a handful of what those symptoms may look like for a person?
Yes. So I think so I'll break these down into 2 buckets, right? The first is when the immune system is active, you tend to feel badly in the same way that you do if you have the flu or COVID, right? Tired, brain fog, difficulty getting out of bed, generally very achy, right? So those are those immune activation symptoms. Maybe you'll have a fever, right? So it's those symptoms, but then together with the symptoms related to the area of the body that's specifically inflamed. So rash is very, very common in lupus. And we always think about the butterfly rash, but that actually doesn't happen in women of color as much, right? So the butterfly rash is this common, this rash over the face here. We say it's on the cheeks, it's not over the lip here. And that is sort of the classic lupus rash. But you can also get other rashes like discoid rash, and that's more common in people with deeper skin tones, right? So that's sort of a round rash, and maybe the outside can be red or sort of purple colored, and in the center, it can be a little bit thinner and lighter in color, right? That is a common rash in lupus. Joint pain. A lot of my patients will have pain, especially in their hands or wrists, especially in the morning, lasting an hour, 2 hours with stiffness, right? They'll say, I can't open jars anymore. That's a very common symptom of lupus. And then if someone develops internal organ involvement, some of those symptoms can be a little harder to appreciate. So that swelling around the heart or lungs, a lot of times patients will say, when I try to take a deep breath in and out, I feel this sort of sharp pain at the depths of my inspiration. That is a common symptom of the lining of the heart or the lung, right? And then kidney disease. So I have to make a mention of kidney disease because it happens in about half of lupus patients, and it's one of the most serious manifestations that we need to pick up quickly and treat. So nobody has a kidney attack. So often you don't know that you have kidney involvement, but sometimes people will develop swelling either around their eyes, like puffy eyes when they wake up in the morning, or swelling on their legs, or they'll say, especially when I go to the bathroom in the morning, my urine has like a foam, a froth on it. Those can be signs of kidney involvement.
Mm-hmm. And you mentioned that 90% of the persons with lupus are women. And there's a woman right now who says, hey, I've been diagnosed with lupus, or I have these symptoms that you're describing, but I want to have children, right? What should they be thinking about when they're thinking about pregnancy? Are there risks associated with it? Is that a trigger? And how should they plan moving forward?
Yes, I am so glad you brought that up because I think, lupus is something that tends to affect women during those childbearing years. And I cannot tell you how many patients I've had who don't want to accept the concept that they have lupus because they're so afraid that that is something that's going to prevent them from having babies. Women with lupus can definitely have healthy pregnancies, but it takes some planning, right? It takes thoughtful planning. So there are a few things that make a pregnancy higher risk when you have lupus. And one of them is active disease. So if we can get your disease in a state where it's not active for 6 months, and then also rule out some of those other antibodies or other factors that can complicate pregnancies, then we can actually be pretty assured that the pregnancies are going to go well, right? So I always tell my patients, lupus is a situation where if you want to get pregnant, you want to get pregnant, and you don't want to get pregnant when you don't want to get pregnant, right? Mm-hmm. So always contraception when you're not wanting to get pregnant. And then once we get that disease activity under control for that 6-month period, and then send you to the high risk OB, as we were talking about before, those pregnancies can go just fine.
And what keeps you out of that active phase? Like, what are some of the treatment plans that can help you to get through that next stage?
Yes. So I always say illness and wellness. Treat your illness, lean into wellness, right? So the illness part of it is when you have lupus, you need to take medications that help your immune system behave more normally, right? Hydroxychloroquine is the baseline. This is a medicine that we used to use for malaria, and it actually works very well for preventing the inflammation of lupus from sort of coming up. So people who take hydroxychloroquine have fewer flare-ups over time, have less of that organ damage that we talked about in the start, are less likely to get abnormal blood clots with their lupus, more likely to have healthy pregnancies, more likely to live a normal lifespan. So all of my patients who can take hydroxychloroquine, I tell them to take hydroxychloroquine. It does take some eye monitoring because there's a rare side effect that can affect the retina or the light sensing nerve in the eye. But that is something that we can monitor for. We pick it up before it ever affects someone's vision. And if that happens, then we have to stop the medication. And then there are other medications that can decrease the immune response. So there are two major buckets. There are the sort of conventional medications that we actually borrowed from our oncology colleagues for the purposes of autoimmunity. And then there are the biologic medications, which are newer ones that are particularly targeted to the kind of inflammation that happens in lupus. And so those are medications that we have good randomized control trials for. We know they work very well, and they can be great add-on therapies to help our patients do well.
Well, for someone who is newly diagnosed, right, can you tell them what the day-to-day looks like for them? What habits can they do to try to help keep this disease from ramping up?
Yes. So one is taking the medication, right? So I think that's one thing that and it makes sense, right? Like, you get this chronic illness, you're a young woman, you're at your prime, right? It's really hard to accept the fact that you're going to need to take a medication for the rest of your life. That is not an easy thing to accept. But people who take their medications live better and longer with lupus than people who don't, right? Now, medications can have side effects. Anything that's strong enough to have an effect is strong enough to have a side effect, right? And so, I always tell my patients, if it doesn't work for you, it doesn't work. I think sometimes people think, oh, wow, I have to take this medication and it's too many pills, or I don't like injections. And, someone's going to say, I definitely have to take this. And if I start it, that's it, right? But that's not true. There's so many options now for treating lupus that there never were before, that we can usually find a regimen that fits with your lifestyle. So working with your doctor to make sure you're taking the correct medications is one, right? The other is not falling back on steroids. So this is a tough one, especially for people who are in marginalized communities, because often if you either lose your insurance, you don't have access to a rheumatologist, or you're going back and forth to the ER because you have flare-ups, the first thing people are going to do is put you on steroids. People who take excess steroids do not live as well with their lupus, have more of that organ damage than people who don't, right? So it's really important to get on a regimen that spares steroids or keeps you from having to take too many doses of those steroids. And then the other thing is that wellness piece of it, right? Lupus is a problem where your immune system attacks yourself. Your own body forgot who you are and will not take care of you, right? That is something that begs you to take care of yourself. Sleeping at least 8 or 9 hours a day, exercising to your tolerance, making sure you're leaning into that healthy diet, getting rid of that stress, getting rid of that person who's stressing you out, breaking up with that man who's giving you bad credit, right? Is very important for your health, right? So all of these things together are very important for making sure that you're living well with lupus and you're taking care of yourself. I always say, if you have a list of tasks to do and you have lupus, task 1, 2, and 3 are self-care. Full stop, right? Give yourself permission to care for you.
It's one of those things. I don't think people recognize how protecting your energy means so much to your physical health that we just take it for granted. So,
yes.
Thank you, Dr. Blazer, for shedding light on a condition that, like we said, 1.5 million people have this disease, 90% of being women, and especially Black women. So thank you for shedding light on it.
Of course. Thank you for having me.
Thank you. And still to come, one mom's personal journey on living with lupus while working and taking care of her family.
I'm Brittany Noble, Midwest-born, HBCU educated with experience in newsrooms across the country. Well, I've teamed up with Roland Martin to bring to you The Breakdown. This isn't just news. It's our stories, our voice, our community. Join me for The Breakdown, Monday through Friday at midday, only on the Black Star Network.
Hey y'all, welcome to The Other Side of Change, only on the Black Star Network and hosted by myself, Bria Baker, and my good sis, Jamira Burley. We are just two millennial women tackling everything at the intersection of politics, gender, and pop culture.
And we don't just settle for commentary. This is about solution-driven dialogue to get us to the world as it could be and not just as it is.
Watch us on the Black Star Network, so tune in to The Other Side of Change.
Living with lupus is a lifestyle. It requires managing severe symptoms and being prepared for unexpected flare-ups. Joining me now to discuss her personal journey with lupus is Tanya Mitchell-Cobb. Thank you for joining us, Tanya.
Hi, thank you.
Yeah. So walk us through your journey. What has been the emotional and mental health journey for you living and coping with lupus?
So basically, mentally, and it's dealing with the fatigue. It's dealing with the up and down with the illness, learning how to cope, learning which medications are going to work, what doesn't work. I was diagnosed back in 2004, so I was about 30 when I was diagnosed, but it was a journey to my diagnosis. We didn't know what was going on. I just knew I was sick. And we had no idea what was going on. There were so many different things. And that in and of itself was an emotional journey. When I was when I was finally diagnosed, it was almost a relief, but at the same time, fear, because my mother also had lupus. And so I knew what it looked like, and I was afraid of what my life was going to end up as.
Oh, I'm so sorry to hear that. You know, it brings up a couple of questions for me, though. Were your symptoms the same or completely different than the symptoms that you saw in your mom?
Well, my mom was diagnosed or began to have symptoms in the mid 80s. And so there really wasn't a name for it, you know, at that time. So I remember my mom dealing a lot with the swelling and just having a lot of medical issues. I was very young at the time, so I don't remember exactly. I just knew my mother was in and out of the hospital and no one knew what was wrong. For me, I had a lot of abdominal issues. I had swelling. I was retaining fluid to the point where I couldn't walk, headaches. No one knew what was wrong with me. And oddly enough, I ended up with pancreatitis. But it was an illness that pretty much affected people who had heavy drinking habits. And at that point, I was 26 and I didn't have, you know, drinking habits that would lead to pancreatitis. But that was the kicker. That was the one abnormality that kind of led them to dig a little deeper and began to do the ANA. And every other check mark checked in the box that was, you know what, this is lupus.
Wow. And when you say swelling, was it that your legs were swelling on you? And if so, did they ever check your kidney function to see why you were retaining fluids?
At that point, they did. So as my legs were swelling, my arms were swelling, everything on me. I went in May, I was a size 2. And by July, I was a size 12.
Wow.
It was just the imbalance of everything. And no one knew what was wrong. And honestly, it was months that turned into years of just going back and forth to the doctor until they just constantly, one doctor said, let's do an autoimmune family tree because this is autoimmune. Wow. And then they started just working down and checking things off. And they diagnosed me with lupus in 2004. And so I've been living with it since then. And I always say lupus likes to go to the party with a friend. Oh. And so you end up with another autoimmune. And for me, I ended up with rheumatoid arthritis as well.
And can you explain to people who are listening, what's the difference in your lupus symptoms versus your rheumatoid arthritis symptoms?
They're really are similar because you have the joint pain, you have the swelling, especially in the morning when you wake up. My joints, my hands are swollen, my joints ache, my ankles, my hips, my joints ache every morning. It takes effort for me to get up and to get ready to go to work. Like it is effort for me to begin my day because I'm in pain. I'm extremely fatigued. I am just going about my daily activities. I honestly feel as if I've ran a marathon, but I can't look that way. I need to continue moving as if life is normal.
Wow. Wow. And I can imagine the emotional toll that takes of, I have to look like everything is normal,
Yeah.
and that stress in itself, I would assume, triggers some flare-ups. Like, what are the triggers you've noticed along the way that causes you to have more and more aggressive symptoms?
So stress definitely is a trigger. I also noticed that if I get off my medication regimen, then, because sometimes, honestly, taking the amount of medication that you have to take, you get tired. You get tired of having to take so many pills a day. I also go for monthly infusions. I have to go I get my blood checked pretty much about every weeks. You get tired of having to do this. But if I do not take the medication, then I'm going to end up with a flare. If I constantly have to just move, my children have very active lives and I'm right there with them. If I don't get the rest that I need, I can end up in a flare. I have a very demanding job. And if I just constantly keep going, I can end up in a flare. And it takes a lot for me to bounce back. The fatigue is just unbelievable. It's almost as if I ran a marathon or if I was awake for weeks on end.
And people, listeners, you have to realize the reason why you feel so tired like that is that her immune system does not go to sleep. It is constantly revved up. Right.
My immune system is constantly fighting itself and it affects my organs. So I have had multiple surgeries. I've had, my organs have been affected. I just recently had surgery in January. It's a lot. It's a lot. But when people say, oh, hey, how are you? You're going to say, I'm fine. Everything is great. Because people really don't want to know that you don't feel well. Automatically, you don't want to always say, you know what? I really don't feel well. My body hurts. You just have to keep moving and keep going because you don't want to always be that friend that doesn't feel well or the one that has to cancel plans all the time. You just have to keep going. And that's a lot of the mental stress. And that also that can also put you into a flare.
Yeah. So what changes have you had to make? I'm sure there comes a time where you're like, even if I want to give it my all, this is my all is staying in this house. So what changes have you had to make in your daily routine to help manage and hopefully prevent some of these flare-ups?
I had to learn that no is a sentence and that if I can't do it, it's okay because I have children that need me and they need all of me. And if I can't give 100%, if I can't meet my friends for dinner because I can't get out of bed, then I need my energy for something else. Sometimes in the lupus world, Luppies will say, it's spoons. How many spoons do you have? Right. And I don't have enough spoons to go have dinner or go to brunch, meet friends, go see a show, and then prepare for the next day. I have to see how much energy I have. So you have to that's okay. Your health is what's most important. And it took a long time for me to learn that I don't have to run around with a cape on.
Right.
I have to protect my peace in order for me to be emotionally and physically okay.
Right. You mentioned with your treatment plans that you take multiple pills a day. I'm not sure how many pills that is, and including the infusion, right?
Yeah.
How often, even with that tight regimen, how often are you seeing that you're having a flare, or how many quote unquote good days do you have in between with that type of medication plan?
So right now I'm good. I may have, as of right now, I may have about 2 or 3 flares in a month. We just increased my infusion and it has been going very well. And so I feel good. I really do. There are times, and I also have pain management. Okay. And so that's a part of your treatment plan, is to have is to see a pain management specialist, someone who, and for me, my rheumatologist has me seeing someone who doesn't do opioids, which is very important. So a way that we can treat my pain that doesn't have me on something very strong, and learning other ways to treat my pain. So that's very important to me. And it's just a method of it. So I can control pain at home, but there are times where I can't control my pain at home, and I do have to go to the emergency room in order to get out of pain.
Yeah. Yeah.
And that happens several times a year.
Yeah. And not being afraid of saying, hey, this is too much when my body is attacking myself. What words of advice would you offer someone who they're newly diagnosed with lupus? You say you watched your mom go through this. I can imagine the emotional load of saying, okay, my mom was older than me, so I have to look out for this for the rest of my life, right? What would you say to someone who's newly coming into this diagnosis about what support system they need to have in place, how to find the right advocates for them when they're going to different doctors, and what type of doctor they need to actually invest their life in?
So the first thing I would say is that you can definitely thrive with lupus. You can definitely be a lupus warrior. You have to understand yourself, and someone who has been diagnosed with lupus, their story is not going to be your story. We are all so different, but be an advocate, understand the illness. Make sure that you have a great support team. Make sure that all of your specialists have direct links to your rheumatologist, your gastroenterologist, your eye doctor. I mean, there are so many different specialists that you have to see, but make sure they all have a link to your rheumatologist, because that rheumatologist is like the center of the wheel, and all of your other specialists are just like the spokes in the wheel. But advocate for yourself. You know when you do not feel well. You know when something is not right. Speak up for yourself, and also find a community of other lupus warriors and thrivers that are doing well, and just have someone that can speak life and energy into you. There are so many other people who do not have lupus that go on the internet and get an instant MD and think that they can diagnose us and tell us what's best for us. No, that's not the case. You have to get with a community of people that understand that it's okay for you to just lay on a sofa. It's perfectly okay. Go get that weighted blanket, get that cup of tea, get the heated blanket, and just rest. It's okay to rest and just speak.
Yeah. It's one of those things, it may not only be okay, it may be actually necessary for you to rest, to allow that to get down. Tanya, thank you for helping others feel seen, understood, and less alone in their journeys. You mentioned them finding a community. Where should people go if they want to say, hey, I want to be in your community? Where can they find you?
So the Lupus Foundation actually has branches in the state. So that's one way that they can do that. And believe it or not, there are so many different organizations or groups on Facebook. So there's one Butterflies Association that there's on Facebook that has lupus survivors and thrivers. And we often just chit chat and talk. If someone's having a difficult day, we can pour encouragement into each other. There's an annual lupus walk that happens in different states. Sometimes we can't walk that far, or we can't even walk in the walk, but you can volunteer and pass out the tags or those different types of things. But just find a community of people and just talk to them and encourage each other.
Well, thank you, Tanya. You've been an encouragement for us, and I'm sure, like I said, people will be looking out because they need someone to lean in. Community is important. Rest is paramount. So thank you.
Thank you.
And still to come, my prescription of the week.
Y'all, welcome to The Other Side of Change, only on the Black Star Network and hosted by myself, Bria Baker, and my good sis, Jamira Burley. We are just two millennial women tackling everything at the intersection of politics, gender, and pop culture.
And we don't just settle for commentary. This is about solution-driven dialogue to get us to the world as it could be and not just as it is.
Watch us on the Black Star Network, so tune in to The Other Side of Change.
Let me share something personal because this is something I lived through. I hope that my story could potentially save another woman's life. So here goes. I was completely healthy, no chronic conditions, no medications, an active lifestyle, healthy diet, and it happened to me, pre-eclampsia. Now, throughout this series, you've heard me mention my beautiful babies. I'm a twin mom, a very proud one at that. But in sharing the absolute blessings that they are, I haven't shared the full story of how my life nearly ended after their birth. You see, I delivered my twins at 35 weeks. They're identical. In fact, so identical that they shared a placenta. And given this, my pregnancy was considered high risk and I was followed very closely. How closely? Well, while most pregnancies, you have 1 to 2 ultrasounds the entire time that you're pregnant, I had 1 to 2 ultrasounds per week during the last 2 to 3 months of my pregnancy, all to monitor their growth and make sure they were both getting enough blood flow since they did share that one placenta. And every time after every ultrasound, I heard the same thing. Everything looks fine. And things were great, and after 35 weeks of anticipation, I delivered my beautiful babies and I was on cloud 9 of being a brand new mom. Now, one of my little ones, she was born at 3 pounds, 8 ounces. And although she was tiny, again, 3 pounds, 8 ounces, she was as strong as an ox. She needed no support for her lungs, no oxygen, nothing. She just needed to go to the ICU so she could gain weight. Yes, because you have to be 4 pounds before you can go into a car seat. So she needed to gain half a pound. And because of that, the doctors told me, hey, you can either go be discharged home, or since your little one is in the ICU, you can technically stay up to 5 days in the hospital as an admitted patient so you can be closer to her. And so I said, oh, for sure, let me stay. And I say to this day, because my little one, because she weighed half a pound too small to be in a car seat, that she saved my life. You see, on that second day of me traveling back and forth to see her in the ICU, I felt fantastic. And on that third morning, I woke up and my nurse said, hey, before you go to the ICU to go feed your baby, just let me check your blood pressure for the day, and then you can be on your way. I hurriedly rolled up my sleeve as I'd done the prior 2 days before, and I waited as the cuff began to inflate. But this time it did something different. And I've heard this a couple of times with my patients, right? It started to cycle again. And I knew exactly what that meant. And if there was any confusion at all, I could look at my nurse's face and it said it all. I glanced at the monitor and I saw the flashing numbers glowing in red. My blood pressure was 200/110. She immediately tried to put me at ease and said, let's just check that again. But to no avail, the repeat number was even higher. I had severe postpartum preeclampsia. And here's the shocking part that it shocks me still to this day. I felt absolutely fine. I had no headache. I had no vision changes. I had no swelling in my legs. I had no warning signs. And if it hadn't been for my blood pressure being checked that day, if my baby was not in the ICU, leading me to stay in the hospital for an extra 3 days, I could have gone home thinking everything was okay, while my body was heading right towards a heart attack, stroke, or even death. And that's what makes preeclampsia so serious. It doesn't always announce itself. Luckily, my preeclampsia was caught, but it was stealth. I ended up being maxed out on 3 different blood pressure medications, taking them 3 times a day for 4 months. Not days, not weeks, months. And I remember thinking, this could have cost me my life. Many people think preeclampsia only happens during pregnancy or that you will always have symptoms, but this couldn't be further from the truth. It can happen before, during, or after your delivery. It can happen to people who had no prior health issues at all. And you can have all or no symptoms whatsoever. But regardless of when it happens or if you have symptoms or not, the end result, if left untreated, is all the same. Pre-eclampsia can lead to strokes, seizures, organ damage, even death if it's missed. And for Black women, especially, the risk is two to three times higher, and the outcomes are worse. So here's what I want every person listening to know. Just because you delivered your baby doesn't mean the risk is over. Check your blood pressure. Yes, even if you're at home. Ask for follow-up. Pay attention, even if you feel normal, because I did. I had no symptoms, and my numbers were still life-threatening. Advocate for yourself. Take that follow-up appointment seriously. And if something doesn't feel right, even if you can't explain it, just get checked. If your blood pressure is greater than 140/90, call your doctor. If it's greater than 160/110, you go to the emergency room. Your life matters just as much after delivery as it does before. And if my story does anything, I hope it reminds you, silent doesn't mean safe. And that, my friends, is my prescription of the week. Thank you all for joining, and we'll see you next week on Second Opinion.